Welcome to our channel. Today, we're going to discuss something that many people have experienced, a faint line on a pregnancy test. If you've ever seen a hint of pink and wondered what it means, you're not alone. We're here to help you decipher that line and provide guidance on what to do next. In this video, we'll cover how pregnancy tests work, what a faint line could mean, how to choose the right pregnancy test, when to take the test, and some tips for a successful pregnancy test. Understanding how pregnancy tests work. Pregnancy tests are designed to detect the hormone human chorionic gonadotropin, HCG, in a woman's urine. This hormone is produced by the cells that form the placenta shortly after the fertilized egg implants in the uterus. Most pregnancy tests involve dipping a strip or stick into the urine or placing a few drops of urine on a test strip. Once the urine comes into contact with the test strip, the HCG in the urine binds to a molecule on the test strip that is specific to HCG. This binding triggers a chemical reaction that results in a color change on the test strip. If the test shows a positive result, it means that HCG was detected in the urine, and the woman is likely pregnant. Decoding a faint line on a pregnancy test, what it could mean. A faint line on a pregnancy test can be confusing and stressful. Here are some possible explanations for a faint line on a pregnancy test. Early pregnancy. A faint line can indicate early pregnancy, which means that the HCG levels are still low. In such cases, the best option is to wait a few days and take the test again. Chemical pregnancy. A faint line on a pregnancy test can also indicate a chemical pregnancy. It can be caused by genetic abnormalities, hormonal imbalances, or other health conditions. Evaporation line. Sometimes, a faint line on a pregnancy test may not be a positive result, but instead, an evaporation line. This line can appear when the urine evaporates on the test window, leaving behind a faint mark. Faulty test. Faulty pregnancy tests can produce false positives or false negatives. It is essential to use the test according to the manufacturer's instructions and check the expiration date before using it. Medications. Certain medications that contain HCG, such as fertility drugs, can interfere with the accuracy of pregnancy tests. If you are taking fertility treatments, it is best to consult your doctor before taking a home pregnancy test. Choosing the right pregnancy test, blue dye, pink dye, or digital. When it comes to choosing a pregnancy test, there are several options available on the market. The three most common types are blue dye tests, pink dye tests, and digital tests. Blue dye tests. Blue dye tests are the older type of pregnancy test and are typically cheaper than pink dye tests. However, they are often criticized for being more prone to producing faint lines, evaporation lines, and false positives than pink dye tests. They can also be more difficult to read accurately. Pink dye tests. Pink dye tests are becoming increasingly popular because they are less likely to produce faint lines, evaporation lines, or false positives than blue dye tests. They are also easier to read accurately because the pink color is more distinguishable from the white background. Digital tests. Digital tests are the newest type of pregnancy test and work by displaying a digital message that reads either pregnant or not pregnant. They are easy to use and provide clear results, but they are often more expensive than traditional tests. Some women prefer digital tests because they feel it provides a more definitive answer, but it's important to note that they still have a margin of error like any other pregnancy test. So, which one should you choose? Ultimately, it's up to personal preference and budget. If you're willing to spend a little more for the added convenience and clarity of a digital test, then that may be the best option for you. However, if you're looking for a more affordable option that still provides reliable results, a pink dye test may be the way to go. When to take a pregnancy test. Knowing when to take a pregnancy test is also important. Taking a test too early can lead to inaccurate results, which can be frustrating and confusing. The ideal time to take a pregnancy test is after you've missed your period. However, if you have irregular periods, it can be difficult to determine when that is. If you're unsure about when to take a test, there are other signs you can look out for. For example, if you experience nausea, fatigue, or breast tenderness, you may be pregnant. However, these symptoms can also be caused by other factors, so it's important to take a test to confirm. It's also important to note that some pregnancy tests claim to be able to detect pregnancy before a missed period. However, these tests can be less accurate and are often more expensive. If you're not sure, it's best to wait until after you've missed your period to take a test. Taking a pregnancy test can be a nerve-wracking experience, but it's an important step in determining whether or not you're pregnant. By understanding how pregnancy tests work, when to take them, and what to do after you get your results, you can feel more confident and empowered in your journey to starting a family. Remember, every woman's experience is different, and there is no one right way to navigate pregnancy. Trust your instincts and don't be afraid to seek support from healthcare professionals, loved ones, and online communities. Thank you for watching. Like, comment, and subscribe.